Well, we all want to enjoy our summertime activities, but if unsightly spider veins or varicose veins keep you from feeling comfortable in shorts or a swimsuit, we have some help for you today. Dr. Tif Siragusa is a board-certified vascular surgeon with Siragusa Vein and Laser Center. He's here today to talk about the latest non-surgical, minimally invasive treatments that can get you back to enjoying your life once again. That's very important, isn't it?
Absolutely.
It really is. And, you know, it's not just how you look, but it's also how you feel. Some of these problems can really be, health problems.
Right. Varicose veins are a problem with the circulation due to the improper functioning of the valves in the veins. Veins are meant to bring blood back to the heart from the legs, and when the valves don't work, all this old blood stagnates and builds up in the legs, causes swelling, pain, achiness, can even cause skin discoloration and skin breakdown, leading to open wounds.
So those are some of the symptoms that we'd be seeing then if we had a problem like that.
Correct, yes.
Yeah.
Yeah.
Let's take a look at some before and after pictures. You can make a radical difference in somebody's appearance and in their life, really, when you do some of the treatments that you do.
Yes, absolutely. When the vein does not work and the blood does not circulate, it accumulates in the legs and causes these varicose veins. And this is a typical result after a laser treatment that we do to alleviate the circulation problem, and then another procedure that we do to remove the bulgy varicose veins.
That's a radical difference, isn't it?
It is, and the results are really instant. By the next day, the patients typically notice that the legs are much better looking, and also that they feel much better as far as swelling and achiness goes.
And this isn't just a problem for women.
No.
It's a problem for men as well.
About a quarter to 1/3 of our patients are men. Here's a typical result of a man who we saw. Men typically present a little bit later. They're more reluctant to go for medical therapy and to get things treated until they get a little bit worse, or until their wife or significant other coaxes them to get it treated. Yeah.
There are many different ways that you can treat these problems in your office.
Right.
It's very important to have a board-certified vascular surgeon treating you.
That's what I believe. Yes.
Yeah. Okay.
Yeah.
Talk about some of the different ways that you can treat these.
So the basics are that you want to seal off the vein that is not working properly, and you can do that with either heat using laser or radio frequency, or you can do it with chemicals, including a medication called Sotradecol. And the chemical treatment does not have any risk of injury to any adjacent nerves or any burn side effects either.
Okay. You have a new treatment called Clarivein, and we're taking a look at this right now. Tell me what this is.
So this is a device that goes inside of the vein, and the idea is to damage the inner lining of the vein. Instead of doing it with heat, the way this device works is the tip of it spins around pretty rapidly and causes a mechanical injury to the inner lining of the vein. And then it also infuses a medication that causes the vein to seal off on itself as you withdraw this catheter. This video is demonstrating the catheter with the inside of the vein, with the front part of the vein cut off just so you can see inside of it. And as it spins, it literally damages the lining of the vein, and the chemicals that are then injected seal it off.
So that just collapses the vein then?
It just collapses it.
That's just fascinating.
Yeah.
Is this a lifelong fix then, once you do that?
Varicose veins are very hereditary in nature, and so we have a surveillance program for patients who have treatment of one vein and a set of problems today. There's a good chance they'll develop a problem in another vein 1, 2, 3, 4 years from now. So because of that, you can't really cure varicose veins. You treat them as they come along.
All right. Dr. Siragusa, thanks so much for being with us today.
Oh, thank you.
If you'd like more information, Siragusa Vein and Laser has 2 locations in Nashville and in Hermitage. All the information is on our website and also online at NashvilleVeinandLaser.com.